Amnesia. Repeated memory loss is considered as amnesia. So, it is a memory disorder characterized by sudden retrograde episodic loss over a period of time ranging from hours, years and decades. It can be psychogenic amnesia or dissociative amnesia. The types can be retrograde amnesia, that is forgetting events happened just before the event which caused the amnesia. Means just the events before that amnetic period we can say. So, the recently stored past memories are lost, but the long-term memories are intact. That is about retrograde, means backward we can say. Coming to anterograde amnesia. Cannot form new memories after the event which caused the amnesia. Means it is very common type of amnesia we can say, which immediately occurs just after the head injuries. Transient global amnesia. Sudden and temporary episodic of memory loss, and this is not due to any drugs or psychogenic causes. Coming to diagnosis. This can be diagnosed or revealed. Amnesia can be revealed by MRI, CT scans to check any brain damage or abnormalities. Blood test to check for infections, nutritional deficiencies and other issues. EEG means electroencephalogram to rule out any seizures or convulsive activity in the brain. Just like ECG for heart, we have EEG for brain. Subjective and objective data. Then the client cannot recall important personal or family information. The signs and symptoms causes always distress and confusion in the client. So the main signs and symptoms or the clinical features of amnesia can be memory loss of certain time periods, events, people and personal information. Sense of being detached from self, emotions and blurred sense of identity means forgetting self. Perception of people and things around him or in his environment, and disturbed and everything seems to be unreal. Alzheimer's is a type of like one amnesia, that is one brain disorder, solely destroying the memory and thinking skills and entirely decreases ability to carry out the simple tasks, which is very common after 60s. That is, we can say age-related amnesia. The main causes of amnesia can be, that is dissociative amnesia is due to overwhelming stress, which may be due to traumatic events like wars, abuse, accidents or any natural or man-made disasters. The person may suffer the trauma or just witness the trauma. Others can be head injuries, severe illness, increased fevers, seizures and emotional shock, hysterias, barbiturate or heroin, that's drugs, and general anesthesias, sexual assaults, exposure to overwhelming traumatic experiences. All these causes contribute to amnesia. The other types of dissociative amnesia can be localized amnesia. It is very common type of amnesia where the patient or client will forget about the personal information, means identity or self, but having the memory for all the general information. That is called localized amnesia. Selective amnesia and continuous amnesia, systematized amnesia, general amnesia, dissociative fugue and specific amnesia are other types of amnesias. These are also can stem from issues relating to personal identity and past experiences. The amnesia comes suddenly and can last for hours, days and weeks. Coming to generalized amnesia, the loss of memory for one's entire lifetime experiences. That is called generalized amnesia. Coming to the treatment aspect of amnesia, it depends upon the severity of the person's memory loss. If memory loss is for short period, the supportive therapy is the first line of treatment, where we have to give support to the client from the family side and other friends even. Coming to severe cases of memory loss, which needs more care and support from the family, environment and etc. And things helps them to recover lost memories naturally. If it fails, then we have to go other treatment aspect, that is hypnosis. Retrieving the lost memories, that process is called as hypnosis. This also causes traumatic experiences, so it should be used very carefully by trained professionals only. After recovering from amnesia, doctors use variety of psychotherapies to decrease the frequency of episodic memory loss or episodes of memory loss and help the patient cope with the normal daily life. The other treatments can be CBT, that is cognitive behavioral therapy, which explores understanding the conflict and trauma that the client is facing, so that he can change the thought patterns. If negative thoughts are identified, then the coping strategies are enhanced and implemented in the case of client treatment plan. EMDR, eye movement desensitizing and reprocessing, to decrease the stress from previous trauma experiences by combining the CBT with visualization techniques. Next, DBT, Dialectical Behavioral Therapy, that is coping strategies to deal with destructive thoughts. It also helps to regulate the emotions in the client. It's done by interviewing the client immediately after the traumatic event, so that is will be having a great help. The patients receive treatment as soon as the problem has occurred, that is symptoms have occurred regarding this trauma or this amnesia, then the prognosis will be good. So earlier the treatment, better the prognosis. Thank you one and all.